Put that on. Awesome. So you have a lot of titles: physician, scientist, health work, social entrepreneur. So can you tell us, how do you balance being like working as a doctor, like as a physician, and also the working on entrepreneurship and like producing products? Because they seem like they're both, I feel like in both roles, people find it hard to have like a work-life balance. So how can you do both of them?
Yeah, I think it goes back to like the ways that we label ourselves, right? Like, I only use those titles to communicate easily in a societally acceptable way, like what it is I do. But increasingly, as I mentioned before, I'm just trying to think of myself as like, okay, what is the big question that drives me in everything that I do? And the synthesis of this is like, how do we be healthy in the world? And so, work-life balance is my work the steps I go through to generate income so I don't like starve to death, or is it finding meaningful things to do that like make progress towards my big question? So we all have the same 24 hours in a day. It's just a matter of, in my mind, if I'm lucky to be in a position where I don't have to necessarily feel under the gun all the time about finances, and do have a little bit of liberty to think about like where I want to allocate my time. So recognizing I have the privilege of that ability, I begin to think about, okay, how will I be able to answer this question if the only thing I do is see patients 100% of the time? I think I'm able to get better glimpses of different experiences from doing that, and so I, had to design my own position to say, okay, I will see patients, twice a week, and that will suffice like for what I'll get out of the clinical exposure from it. And then, what are some other things that I want to be doing with my time? Okay, well, looking at health policy and implementation of, telehealth and other interventions. So I set aside time for that too. So it's really more about prioritization in my mind, about like, okay, what's the big question that motivates me? What are the things that I need to do to chip away at this question? And then how can I prioritize my time throughout the day to like actually make progress on these things over time? And so for me, it was hard to like find a job that really fit my job description, if you will. Like, who's going to let you, dabble in this and that and the other thing. But I basically had to make my own job, and I was lucky to stumble across an opportunity where they're like, okay, like tell us what you want to do, and like we'll let you figure it out. So I made up my own job.
Mm-hmm. That's awesome. So if anyone else has questions, feel free to unmute yourself or put them in the chat and we'll speak them out loud for you. In the meantime, I have another question. So you mentioned your interest in addiction, and so that seems like a very large umbrella topic. So how do you break that down into problems that would have like a good, would have a large impact for you to help with, but also are feasible for you to work on?
Yeah, so I think less about the large impact piece and more about like the experiences that I've encountered on a day-to-day basis. And so, one of the driving factors behind one of the projects that I'm working on with some of the folks from Yale Helix actually is the experience of having a patient or a family member come up to me and say, I really struggle to find a place that could treat me for addiction. Or, I searched online and I found this rehab facility that I paid $8,000 cash to. They flew me to Florida, and like I didn't get any real treatment, and I like relapsed right after it came out. I spent another $10,000 doing this, that, and the other thing. Like nobody ever really helped me, or just feeling overwhelmed by the process. And so I think Harlan mentioned this in his like opening statement as well. Like it's to me more about quote unquote seeing a piece of trash on the ground and picking it up, and so recognizing the pain that's behind some of these stories and being like, oh, like what can I do to help this one person? And so it's about like helping one person. You can figure out how to help one person. Okay, who else has a problem that's like similar enough to this one person that I can help them too, and then I can help the next person, and so forth. So I think less about the super big number of, oh, I need to reach like a million people, like, and I won't do it for 999,000 or less. But it's more of like, okay, how can I help one person? And then like, who else has this problem, and how can we help them too and make it sustainable? So that's how some of my work in addiction has come about, is like collecting these specific stories. And even then it can be very broad sometimes. Are we talking about, people with alcohol use issues, or opioid use disorders, which there are certain medical treatments for, versus like cocaine use or meth use, and they may not be the same type of medical treatments used. So focusing in on like, okay, which are the stories that come up most often, and which are the ones that are potentially easier or harder to address, and then going from there. But it does take a long time to collect, like, to become familiar with the different problems that are going on and trying to figure out like why they're happening. So I think preservation is key to figuring that out, and pivoting is very frequent, as you all probably know as well.
And so what has brought you to the CBIT Hackathon this year? What has motivated you to want to engage and mentor with us young minds here?
First, I really enjoy the space that a hackathon creates. It's like very fun and interesting to be able to like encounter people from all over the world, really, and share ideas, like learn new things from people. Because these are like fleeting events, but after you walk away, I think there's a lot of things that are still spinning in my mind. It's like, oh, like that's a new idea that I kind of encountered at a hackathon, or like I hadn't thought about this problem in that lens before. Let me continue to brainstorm. And in a way, it's about exposure, because the more things you expose yourself to, the broader your experience base you can like draw from when things come up. So that's one aspect. And then a second aspect is like, there's a lot of practical advice that I think I learn when I come to these events, whether from talking to teams, or talking to other mentors, that may give me new perspectives on like real problems that I'm working on. So similar to the first thing, like exposing myself and talking to many people to get new perspectives. I really enjoy that. And then there is real possibility of taking an idea. There's like an excitement of growing something from an idea into a real service that's helping real people. And I think many of the ideas here, actually all of them, are rooted in some desire to help people and make a difference. And the key is, do you translate that into an actual product and stick with it and like make it real? If you don't do that, that's fine. But the like what you learned in the process can be very interesting and exciting in things that you bring with you. I'll say that the hackathons, I've been doing hackathons for like a long time now. I've learned a lot of what I know about like design thinking and kind of innovation in healthcare, mainly from these events. Like this is how I started learning about them. And then because I was so interested in it, I started like reading on my own and like practicing these things that I've learned to like build the skills. And ultimately I have to give credit to like, those experiences brought me to where I am today, I think. Like director of design, like I knew nothing about design before. They don't teach you about that in medical school, but because of like all the experiences I had through hackathons and other kind of similar like experiences, I was able to build a repertoire and skill set in this area.
Awesome. Well, we really appreciate you being here. And we got a question in the chat. This question is, what are your views on improved access to healthcare remotely in the public health domain via telehealth services, which are very popular now?
Improved access to healthcare remotely in the public health domain via telehealth services. That's a very broad question. Can you specify any part of that a little bit more? And you can feel free to like unmute yourself and ask if you feel comfortable doing that. Well, I can just give a broad impression about telehealth. I think.
Hello. Hi. I wanted to know, like, if the telehealth services provided in the public health domain, could they help to, with diagnostic capabilities? How useful would that be, and what kind of like care could that provide with improving accessibility to the healthcare sector?
Yeah, so I 100% think there is a role for telehealth in improving access to care. But remember that telehealth is one of many tools. Right? It's like just a way of doing something. And the question is like, when is the right time to use a telehealth tool versus some other tool? And then, of course, other considerations as well, like if you're talking about a rural area, the infrastructure that is present, is there internet in the area? I know talking to, um, so I'm on this like national board for like, telehealth standards and whatnot, and we hear a lot of stories about like patients driving to like a Walmart parking lot to like go on the Wi-Fi on their phone because they have no internet on their house. Is telehealth the right solution there? Um, Debatable. There's like so many factors at play as to why people struggle to access care in an efficient manner. Is there a solution to make higher quality telehealth services, like better compression, better video quality and audio quality with like less latency? Or is it to invest in infrastructure to like build out internet connection in these rural areas? Or is it sweeping policy change to make digital access a social determinant of health and fund it as like a basic utility? um, there's a lot of different ways you could look at this problem of access to care as it relates to telehealth. But I think the fundamental question is, what constitutes like a good healthcare experience, and how do you appropriately match the severity of need that a patient has with the type of service that you're giving? So, telehealth is not appropriate for all medical services, um, and but there is a role for it. So matching the service to the time of need, and then like it's like the right patient, right time, in the right place. So that, I think those are my broad impressions about telehealth for rural areas. In summary, can be helpful, but there are a lot of other external factors that could potentially be attacked um, as as it relates to access issues.
I wanted to ask, how did you decide on your career path? And specifically, why is it that you decide to pursue a master's degree after an MD degree? Is there a reason for it?
Um, so I'll say my career path is still evolving. I have constant thoughts about like, what is it I'm going to do next? Do I see myself in my current role for the next 2 to 5 years? Like, do I want to move on? Again, bringing it back to the thesis question of like, what does it mean to be in a healthy world? And, for example, working on telemedicine a lot right now, do I see that as salient to my long-term vision of health? So I don't have an answer for that. I've always, because I don't have an answer though, I'm a bit laissez-faire and that like, okay, what is the next thing I can do that could be like fun, interesting, and that I'm going to learn a lot. I love my new job because I'm constantly learning. There's like a weird mix between policy and implementation and research and so forth. But will I get bored of this in like a couple years? I don't know the answer to that. But I let those things drive me because I'm not like married to my job necessarily, or like the idea of working in a particular position. It's all again about like the bigger question. So if I end up my next position in federal government, like so be it. If it's in a startup, so be it. Um, yeah. So sorry, that's like a bit of a vague answer. And the other thing I'll say is I always keep my eyes peeled for new opportunities because I consider myself to be very lucky, but a lot of that luck I feel like can be like this has also been the case when I talk to people in positions that I admire. They're like, oh yeah, I have no idea how I ended up here. I just like stumbled into it, and you're like, that's such an unsatisfying answer. But if you put yourself out there and like talk to people, network, think about what it is you want, think about like what skills you have. Um, who knows? Like maybe then my next job isn't something that I even thought of yet. But I won't be able to recognize it if I'm not like constantly looking and being open to the possibilities. To answer your question about the master's degree, I think that's a question I get a lot is like, for people who are thinking about continuing their education. And I will say that I was more focused on the skills that I wanted to build rather than the degree itself. The degree actually was kind of a freebie. Like, I could have not gotten the degree. It was like a bonus part of the program that I did. And I would have been very satisfied, because at the time I wanted to learn more about how to make data-driven decisions and translate data into action. And so I was trying to figure out, I didn't have a lot of research methodology training before, so I wanted to learn those skills. I didn't know anything about health policy, so I wanted to learn how that could be one lever that I use to impart change. I had a bit more experience with the entrepreneurship side, and honestly, that wasn't at all part of the master's program, but it was something that I continued to develop in the background. So all I have to say, I think of it more as what are the skills that I want to build, and why do I want to build them? The degree credential is nice as a recognition of those skills, but even if I didn't get that piece of paper, I'm fine, because I learned the skills and I can apply them. It may be a little bit different if you are considering it as a minimum qualification for certain jobs, they would only consider giving you the spot if you had an MBA or something, right? Fine, although that should prompt questions about how that company values skill versus credential, because those are two very different things.
Would you say skills are more important than credentials?
100%. I think credentials are easy to show, oh yeah, I have an MD, or oh yeah, I have a PhD, or whatever. And yes, there was effort and opportunity for knowledge creation and skill gain in getting the degree. But at the end of the day, the degree is a piece of paper. And if you have an MD degree and you don't know anything about practicing medicine, or you're very bad at it, that fact that you have an MD almost doesn't matter, because you're not living up to the expectation of the credential. And in my mind, it's better to be really good at something even if you don't have a credential. How many self-taught programmers are there that don't have PhDs in computer science or a master's or any other formal degree, and they do good work, because at the end of the day, it's about getting the work done and making real things. So definitely would focus on the skills. The degree program can be a way to provide structure to getting the skills. If you're not really sure, what are the things that I don't know that I need to know, having a degree curriculum can help give you a more well-rounded idea of what are the things you need to learn. But if you're on the fence about why you need these skills, I would encourage you to do real things rather than continue to study, because once you have context for real world problems, then you'll start to understand oh yeah, I can see the value of these skills, and therefore I want to learn more about them.
Thank you so much. I have one last question. In your opinion, what do you think is the best area of healthcare to go into right now? Since I'm a first year undergraduate student, and I haven't decided on what career path to take, what do you think would be a best area to focus on? Maybe cancer biology, telemedicine, or other kinds of technology?
Yeah, that's a hard question for me to answer for you, I think. Because the ball keeps moving, and do you want to chase what is hot right now versus what is the thing that keeps you awake at night? What is the thing that inspires you? When I first got into medicine, I was really into cancer biology, and I was doing basic science research. I was okay, I'm going to do novel drug development, and that is great. New drugs for cancer, best cancer treatments. But then as I kept doing it, I was wait, what am I doing? Millions of people out here have no access to even the basic medications that are effective. And so is this work consistent with what I want to do with my life? It's certainly cool, and it gets a lot of attention and hype. And so there's this social external motivation you get because people congratulate you and encourage you to continue working in that space. But in the meantime, there's like a lot of other areas that are broken and like aren't getting as much attention. And so I've started to move away from, and that applies even now with like technology. Like everybody's talking about big data and AI and blockchain and all these other things. And so many programs have popped up, and fellowship training programs and master's degrees in healthcare data science and so forth. But until you know what the problem space you're working in, I think it's like those are just flashy things that may not be as enduring, or like may have to go through multiple iterations of being revitalized before they come into like real meaningful outcomes. So I think I saw Jesse's comment about areas that are most broken. Like I would encourage you to look at that. I think Warren Buffett had a saying like, be fearful when people are greedy, be greedy when people are fearful. And so when you see people running away from a problem, it's worth looking at it and being like, why is that? And what are they afraid of? And why is nobody working on that? I think that's a great place to start. But I will also say you should learn to like work on things that you're passionate about, or like you have a vested interest in, because if you want to get good at it and you want to make real change, you have to like love the problem that you're working on. Otherwise it becomes like, such a chore. I have to like think about this thing. So go out into the world and like do things, expose yourself to different areas of healthcare, things that are popular, things that are not popular, and like talk to people who are having real issues and learn about like what their pain points are, and see what captures your eye.
Actually, I wanted to go off of that exact point, because kind of the app that we presented, we're talking about individual people's experiences, but then also there's a lot of conversations in healthcare about big data and collecting data from large groups and things like that. So I was wondering what your thoughts are on the kind of data you get from big data as well as from individual experiences, and how you can really bring them together in your work per se, and also like in the general idea of this hackathon.
Yeah. So I think like in a research framework, you could say that there's two main types of data. One is quantitative data and one is qualitative data. And each one of them has their pros and cons. Quantitative data is like, you take this huge data set and you're trying to figure out like some numeric feature of it, or like, are there specific groupings of populations that exist within this data set? Whereas qualitative data is more about like stories and what are the themes that are coming out of people's experiences and their tellings of those experiences. The truth often is in the middle. Like as you mentioned, it's the synthesis between qualitative data and the quantitative data. They complement each other in ways that give you insights that either data type alone won't give you. So I think if you're looking for a problem, if you will, qualitative data I find is very rich because they're like true patient experiences told in their own words, like and that was how they felt about something, and you can't get that in an easy fashion through big data. Like one story can tell you things that a large data set can't tell you, and data is only as good as like what you're actually measuring. The big part of big data implies maybe bringing together disparate data sources that haven't been brought together before, measuring a lot of different variables and seeing what sticks. But reality is, I think, in current state at least, there's so many things that aren't being measured that are truly valuable for people's experiences. And so you have to put two and two together, like go out and do qualitative interviews with people and figure out like, how are you feeling? What are the things you're experiencing? Like, tell me about this experience in healthcare. And then you can look at the actual hard data and say, like, okay, these are the outcomes that actually happened, 30-day readmissions or mortality or, some specific functional outcome that you're interested in. And you bring these two together and you're like, okay, here's what we learned from the interviews. Here's what we learned from the data. They match, they don't match. Are they saying the same thing? Why are they not saying the same thing? And then you kind of iterate on that process a bit more. So you could call that a mixed method study, if you will. But I think it's really important to get both sides of the coin. Yeah, as to how to apply that in to the hackathon. I think that the many hackathon pitches have like a similar structure to each other. There's the emotional story to captivate your attention and draw you into the problem statement, and there's like a zoom out to give you a broader statistic about like, oh, not only is this problem affecting one person, but it's also affecting 100 million other people who have similar experiences. And so like even that brief statement of the problem or framing of the problem is a qualitative component, which is the story, and then also a quantitative component, which is the statistic behind like outcomes that have been measured. And when it comes to, so that's how it can be helpful in the product introduction of the problem. But when it comes to designing the product, I think one thing to consider is the qualitative piece and how, for example, the emotional aspect of an experience is or is not addressed by your device. And so, for example, if you're in like a highly emotionally charged environment and your product is like a chatbot or an app that just like gives you automated messages or something, think about how this person is feeling when they're having this experience, and do they want to engage in this tool? I think if you only looked at the data and you're like, oh yeah, 100 million people have this problem, like let's make a chatbot to like automate and triage, but you don't address the emotional component that comes along with that, you're going to fail because you didn't understand the kind of deeper motivations and like drivers of why people do the things they do. So that's how I think qualitative interviews like really help inform product development. And then in terms of business model, again, the qualitative piece can help you understand motivations and why they would buy or not buy something. But then the quantitative component can give you a sense of scale, like, oh, 100 million people is kind of our segment that we're looking at, or it's 10,000 people, or it's 50 people. So anyway, that's kind of like a broad strokes answer to your question.
Thank you so much.
Hello.
Hi.
Hi. So I had one question. So earlier I talked about telehealth services. So I wanted to know that the telehealth industry currently does not, take any real diagnostics. Like it relies on what the patient has to tell about his condition. So why is the telehealth industry not moving forward to remote diagnostics? And like, has the technology not yet been perfected, or is it something which is not required at the moment?
So I would say that there are remote diagnostic tools available. When I was working at the Veterans Affairs Hospital, we had a telehealth clinic where I would basically substitute in for doctors who didn't show up at another clinic, for example. And so we had these like remote stethoscopes, remote otoscopes, and a bunch of other devices where somebody, usually a medical assistant in this specific example, would put this like the device on the patient's chest and move it around in a structured way or at my direction. And so when the person put the stethoscope on the chest, I could hear the heart beat even though I was miles away. So these tools do exist, and you could think about the humble blood pressure cuff, right? Like nowadays, you can, in many places, you can walk into a pharmacy and buy an automatic blood pressure cuff. And so, if the patient has a device like this at home, they could put it on themselves, they could check their blood pressure, and then while they're video chatting with their physician or other provider, they can say, oh, the machine says my blood pressure is 120/80. Or same thing with blood sugar monitoring. A lot of these devices, blood pressure cuffs, glucose monitors, they also start nowadays upload to the cloud, and you can like literally feed data into some other interface. So I think some of the basic stuff does exist. The more sophisticated tools like the stethoscopes, the otoscopes, they're not as widely available, but the technology is feasible. Like it does exist. And then the more advanced diagnostics like ultrasounds or other things, like those tools are starting to pop up